This presentation shares some of the main results of a study developed by Doutores da Alegria Research Center in Brazil regarding the hospital staff perceptions about the work of Doutores da Alegria on the pediatric settings. Doutores da Alegria is an NGO that was born in Brazil in 1991 that adapted the clown care unit's work principles for the Brazilian reality. The work of the clown care unit in the USA pioneered a working methodology mainly focused on the sick children and claiming for a positive, sharing and personalized approach aimed at the child's well-being and quality of life inside the hospital. Currently, Doutores da Alegria are 22 years old and have 40 clown doctors in their professional team. These professionals are artists that are specifically trained to work in hospital settings and with pediatric patients. Nowadays, Doutores da Alegria visit 11 hospitals in São Paulo and Recife twice a week, 42 weeks per year. In an attempt to have a closer look at the work of these clown doctors, Doutores da Alegria's Research Center, directed by Morgana Masetti, the first author of this communication, designed a study where the focus were the pediatric staff perceptions regarding the work of Doutores da Alegria. Two main questions were approached. What kind of impact on people and processes do these professionals perceive as being a consequence of the Dr. Clown's intervention in the pediatric unit? More specifically, how does working together with Dr. Clowns in the hospital wards changed their perceptions and attitudes towards their profession? For example, in what concerns to the meaning of their work, the kind of relationship and communication processes established between them and the children, their families and the professional team, or at the way they look at the diseases and the pediatric patient. In order to get some answers to these questions, the research team developed a specific instrument, the questionnaire of health staff's perceptions regarding Doutores da Alegria. This instrument contains a total of 40 items organized around a 4-point Likert scale from 1, strongly disagree, to 4, strongly agree, and assesses 8 dimensions of the work of the clowns: the relationships inside the professional team, the relationship of hospital staff with themselves as professionals and persons, the relationship of these professionals with pediatric patients and with parents or families, the impact of the clowns on the family's relationship with the child's condition and treatment, on the children's relationship with their own clinical condition and with the treatment, the permanence of the clown's impact on children, and finally, the impact of the clowns on the health professionals' cultural development. The application of the questionnaire was held in 13 hospitals in Brazil, where by the time of the study, Doutores da Alegria were operating. 8 of these hospitals were in São Paulo and other 5 in Rio de Janeiro. As seen in this table, the sampling, using the stratification method, sought an equitable distribution of participants by the 13 hospitals involved in the study. Therefore, the percentage of participants in each hospital varied between 6.3% and 8.8% for each group. As we can see in this other table, regarding the profile of the participants, a total of 567 health professionals participated in the study. In terms of their profession, the group involved medical doctors, nurses, nursing assistants and residents, as well as hospital staff working in administrative departments and in support services. Regarding the unit, almost half of the participants worked in the wards, 15% in the intensive care unit, and around 8% in the outpatient services. Regarding the time they were working in the hospital, approximately 1/4 of the participants worked in that hospital for less than a year, and almost 45% worked in that hospital for at least 5 years. Taking the global group, about 60% already worked in this hospital for at least 3 years. Regarding the longevity of this experience in healthcare, 65% had an experience of more than 4 years, being the most experienced group, around 15%, working in this area for 15 years or more. Regarding the work of Doutores da Alegria, almost 3/4 of the professionals were familiar with the work of Doutores da Alegria for more than 1 year. In terms of some of the main results in the 8 dimensions of the instrument, we can see that the professionals perceive the permanence of the clown for the child as the most impactful dimension of the clown's interventions, closely followed by the influence they perceived on the child and the family's relationship with the disease and the treatments, and as well as their positive influence on the professional's relationship with the child. Taking a closer look at the results in each of these 8 dimensions, considering the items included in each of them, we can see that regarding the permanence of the clown for the child, these professionals point out that very frequently the child asks for the clown's return to the bedroom and remembers and imitates the games played during their visit. Regarding the child's relationship with their clinical condition and treatments, perceived as the second more impactful dimension of Doutores da Alegria, we can see that the clown's existence contributes to the child's more positive experiences, making them more active, more lively and joyful, as well as more cooperative with the treatments and procedures that are administered by their caregivers. In this slide, we can look more deeply into the perceived impact of the clowns on the relationship of the parents with the child's disease and treatments. In this dimension, the parents express enhanced confidence on the child's recovery, followed by more playful interactions with the child and a more relaxed and comfortable experience. In this slide, representing the professionals' perceptions on the clown's impact on their relationship with children, we can see that amongst the most significant changes, they emphasize the way they now look at the child, no longer just as a sick body, but as a child, a human being. Following, they refer the more playful way to approach children and the use of alternative and more persuasive methods to get their compliance. Some of these methods are referred as having been modeled by the clowns. Regarding the clowns' impact on the professionals' relationship with themselves, as professionals and as persons, we can see that the contact with the clowns contributed importantly for them to feel more calm at their work, to have enhanced job satisfaction, and in a moderate way to the improvement of their performance in terms of the quality of the hospital routines. For example, nowadays, these routines are perceived as mainly focused on the adjustment to the child's and the family's needs and no longer so tightly fixed to the formally conventional ones. Concerning the relationship with other staff members, results show that, in a less impactful way, the clowns in the pediatric facilities helped to the establishment of new relationships in the team. They also contributed, in a more modest level, to a more open environment where people felt more comfortable sharing their opinions with the other staff members, and also for the enforced use of listening skills. In the meantime, after this first effort to get to know the health professionals' opinions regarding Doutores da Alegria's work, in their long experience in hospitals, this research team invested on the building of research fellowships with other hospital clowning organizations and researchers who also had their focus on hospital clowns interventions. Consequently, in 2011, the director of Doutores da Alegria Research Nucleus, Morgana Masetti, joined the International Research Consortium HCRIN, which means Hospital Clown Research International Network, a group of nearly 20 researchers, mostly psychologists, of 6 different countries in Europe and Latin America. In 2012, the team incorporated the Portuguese research project Rir é o melhor remédio? In English, is laughter the best medicine? In both projects, substantial collective efforts are being developed in order to contribute to the progress of this new research arena, namely in terms of the construction and validation of new instruments, the development of theoretical frameworks that can promote the comprehension of these particular phenomena, as well as the validation and dissemination of good practices in terms of hospital clowning all over the world.